This is Our Living Lands, and I'm Antonia Gonzalez. Climate change is making rural indigenous communities' efforts to receive quality health care more challenging. In Nevada, rising temperatures present a growing health risk. Stronger storms can also make traveling to get care difficult. The Mountain West News Bureau's Caleb Radel reports that one tribe has found a solution, a doctor's office on wheels.
It's a clear morning in Lovelock, Nevada, a small desert town about 90 miles northeast of Reno. It's also home to the Lovelock Paiute tribe, which has a 20-acre reservation on the edge of town. I'm at a tree-shaded park where the tribe is hosting its annual health fair. There's live music, jewelry vendors, information booths, and food trucks. There's also a vehicle that looks like a large blue and white motorhome, idling on the edge of the park. But inside are 2 patient rooms and a center lab with a blood draw station. It's a mobile health clinic brought here by the Fallon Paiute Shoshone tribe, located about an hour away. Gabriel Bourne just stepped out of the vehicle.
Having access to this, I was able to get some shots I needed and, that I should have probably had a long time ago, but didn't get.
Time and travel are the biggest barriers, he says. Bourne's a Fallon Paiute Shoshone member, but he lives in Lovelock, so seeing a physician in Fallon is a 2-hour round trip. So when Bourne, who hadn't been to the doctor in more than a year, realized he was steps away from a mobile clinic, he took full advantage.
I'm able to get my eye appointment, which I've needed glasses for a while, along with some cancer screening setups and follow up with the doctor to see labs and everything else.
Accessing quality health care has long been an issue for tribal nations, especially in rural areas. The Federal Indian Health Service has less than 100 hospitals and medical clinics nationwide, all to serve about 2.8 million American Indians and Alaska Natives. And most facilities suffer chronic staffing shortages. Some of the highest vacancy rates have been felt by the Navajo Nation, Albuquerque, New Mexico, Phoenix, Arizona, and Billings, Montana. John Pichon is the director of the Fallon Tribal Health Center, which runs the mobile clinic here at this fair. He says the lack of access was amplified 5 years ago during the COVID-19 pandemic.
A lot of healthcare facilities were being shut down, and with all the services being closed, we needed something to go out to the communities.
After years of driving their vehicles to neighboring reservations, the tribe bought a mobile clinic last year. It was funded by a $673,000 grant from the U.S. Department of Agriculture, aimed at expanding rural healthcare access after the pandemic. The tribe's mobile clinic serves its members and drives to the Lovelock Paiute and Yamba Shoshone reservations, covering a territory of about 200 miles. It can also treat any member of a tribe in Nevada. Pichon says they serve about 2,000 people, averaging about 20 patients each month. They try to visit each tribe at least once a month, but that isn't always easy.
Challenges is weather and distance. They are far away, and during winter, sometimes these areas get a little hard to access.
Other tribal nations in our region are working to bridge the gap in healthcare access. Mobile health clinics are also being used by the Navajo Nation, the White Mountain Apache tribe in Arizona, and the Fort Peck tribes in Montana.
I think having the providers go into the community open their eyes to the needs and how to better serve them.
Dr. Christopher Chai is working at the mobile clinic here in Lovelock. He says they can even act as an urgent care for injuries and wounds.
We will get the random rancher come in with a broken finger and say, what do I do with this? Sliced open, and we can put in stitches.
Pichon adds that the clinic also helps tribal members be proactive instead of reactive about their health.
We have some people that maybe only come in when they're sick, but now they're seeing us for their preventative care when we come out.
Like Barbara Bonta, an elder of the Walker River Paiute tribe who lives in Lovelock.
I've been seeing them for my feet and other problems that I didn't know I had till they start testing this and this and that.
Bonta was brought to the mobile clinic by her daughter, Tia Happy.
With my mom, she can't sit for a long time, in a car to go to Fallon or elsewhere to appointments, so it makes it super convenient to have it here when the mobile comes here.
Happy says her mom's been seeing Dr. Chai for the past 2 years, consistent care that's been made possible by this mobile clinic, which isn't slowing down. This year, the clinic plans to add dental care to its services. For the Mountain West News Bureau, I'm Caleb Radel.
Tune in next week for more stories about how climate change affects tribal communities. I'm Antonia Gonzalez for Our Living Lands, a collaboration of Koahnic Broadcast Corporation, Native Public Media, and the Mountain West News Bureau.
Native Voice One, the Native American Radio Network.